The final days and the final patients.
I'm really disappointed that it's not going to keep going.
This respiratory clinic is one of 6 in Melbourne that will close its doors this week. The state government funding that allowed it to operate will end on Friday.
As a person who lives in the community as well as serves people in the community, in the middle of winter, I was somewhat surprised that we might be closing facilities like this.
The clinics were open to help manage the COVID-19 pandemic and keep symptomatic people away from other patients and staff.
One of the problems with seeing these type of patients in general practice, if it turns out you get a respiratory infection or COVID as a GP, then you're out of work for a week as well.
17 other respiratory clinics in the city will continue to operate throughout winter, but they'll also eventually close. GPs have been told that if they aren't already seeing COVID-19 positive patients face-to-face, they need to work out ways to do so. But many doctors have balked at that.
I think they've lost the plot. There is no change to the status of COVID. It's a very nasty disease.
This practice has set up its own outdoor clinic after its federal funding ran out last year.
We're totally booked out today, a full raft of respiratory symptoms.
But other GPs say it's unaffordable to go it alone. Several are calling for specialised respiratory clinics to be made permanent.
We're seeing no good guidance from authorities, state or federal, about how we should be caring for people with potential COVID.
If we didn't provide this service, well, it would ultimately fall back onto the local emergency department.
The Department of Health says 25 priority primary care clinics have also opened since last winter, and they will offer similar services. But that hasn't reassured everyone.
I think that we've learnt a lot and we're about to forget it, which is a disaster.
There are around 240 COVID-19 cases in hospital in Victoria this week. Natalie Whiting, ABC News, Melbourne.